So I'm going to talk to you a little bit about coming up with a research question, and I'm going to base this on my own experience of my doctoral research, where I was looking at midwifery leadership and identity, and I'm going to talk to you about how that research question came into being and how it actually changed during the process of doing the research. So I worked as a midwife on the antenatal postnatal ward at City Hospital on Bonington Ward, and I used to struggle with the idea of being a midwife. So for myself, I'd had a career before midwifery where I'd been a musician. So I came into the NHS at the ripe old age of about 131 and did struggle with what it meant to be a midwife because it was so different from the world that I'd come from. And sometimes it can be quite hard being around midwives because at times they can be quite down on themselves and talk about, not having a lot of power in the workplace. And I was sort of really interested in how that contrasted with the things that they said about their role. So they talked about being disempowered in the NHS context, but at the same time, they would talk about the fact that as a midwife, they were empowering women, they were advocates for women, they were autonomous practitioners. And I thought that this was quite a contrast in the kind of story they were telling about themselves. And the other story that I kept noticing was that this reference to the management a lot of the time. So when something went wrong or when something was happening that people were unhappy about, there was often this reference to, well, the management says we have to do it. And I became quite interested in this idea of who are the management, and do they mean other midwives or do they mean people outside? So when I was doing my master's in research methods, I started to think about this question quite a lot in terms of midwives' identity, because that was what I was interested in from a research perspective generally. And then towards the end of my master's, about 7 people sent me the same email, which was about a studentship to do a PhD. So basically what it meant was you could be fully funded for 3 years to do a PhD. And I sort of jumped at that because the question that was being put in this research proposal was really interesting to me. So essentially, this is quite unusual because what I did was apply for a job, basically. So the research question was already set. And the research question was something like, what are the exogenous, so exterior, and endogenous, i.e. interior, factors that influence midwives and nurses and allied health professionals in moving into leadership roles? That sounds quite big and quite wordy, and it really was. And I applied for this studentship, and it was like going for a big job interview. And then I was successful in that. And when I started my PhD, the very first meeting that I had with my supervisors, they basically said to me, don't worry too much about the research question. You can adapt that and you can make it into whatever it is you want it to be. What they probably didn't expect was about a month into the studentship, a lot of leadership programs started in the East Midlands and East of England. And several of these were about midwifery leadership. So this was leadership development programs that I was going to be very interested in. And I started to do a literature review around leadership in the NHS and clinical leadership. And I began to think, do you know what? I don't think I can look at midwives, nurses and allied health professionals because they're 3 very different contexts. And also, this is massive. And would it not be enough to just look at midwives? Because as I've said, midwives are my interest. So I was very lucky that I had very sympathetic supervisors, and they agreed with me and decided that actually, yes, midwifery leadership was a really good thing to look at. And then from there, I started to explore various literatures around leadership in general, leadership in the NHS, clinical leadership, the history of midwifery, all of these kind of things. But I didn't really have a clear question that I was going to ask, other than the one that had been set. And I knew that I wanted to do something vaguely different from that. And then I had a presentation that I had to give at the end of my first term of the PhD studentship. And it was about describing your research in just 4 slides, 4 PowerPoint slides. And this was quite a challenge, you can imagine. Had a lot of literature that I'd looked at. And it was okay, the presentation went well. And then after it, because I was based in a business school and they really like theory, one of the examiners of this set of slides said, so what's your theoretical framework? At which I went, I don't know, because in my head I thought my theoretical framework was something to do with leadership. But it turns out that a theoretical framework is a lot deeper than that. And when we started to look at what kind of things I could be exploring, we discovered that what we were actually looking at was identity. So it was all about, what does it mean to be a midwife in the context of your own identity? So how did you go from being a clinician to being a leader or a manager? And then what are the other stories that you're interacting with when you make that transition? So how do other people perceive you? So you might think to yourself, well, I've moved to leadership and I'm still a midwife. Other people might give you a completely different story, which is, well, you're not a proper midwife anymore because you don't work clinically, so you're not really one of us. And what's the impact of those kind of stories on how you feel about your role going forward? And during this presentation and the kind of questions and answers afterwards, somebody said something about, well, these people that put their head above the parapet, they're just going to get shot at. And I thought, that's a really interesting phrase. I quite like that. And then I was doing a poster presentation during my first year, and I wanted a really good image to have on this poster, because the poster was going to be about what the study will be about rather than what I've done already. So I put into Google Images, heads above the parapet, and the second image that came up was a giraffe. So for some reason, I decided that a giraffe would be the thing to use. And so the study then became called Heads Above the Parapet. That's its short title. And then the secondary title was Leadership Identity Among Midwives and Their Development. So it was a long and well thought out process, obviously, involving a giraffe. And the giraffe actually proved really useful, because the giraffe has followed me around in everything that I've done since. And it makes a really nice image. So I've kept my research question. When I submitted my PhD, I was very tempted to have as my front page an image of the giraffe, but I decided as I was in a business school, this probably wasn't the best idea and it might make them think I was joking a bit, so I didn't. But yes, that's the story of how I came up with a research proposal title. And the one thing that I would say to anybody when they're thinking about research, and I will probably say this to you in the classroom as well, when you're trying to come up with an idea for research, and we ask this question, who's got an idea so far? And half the room will say, no, I haven't got a clue. My advice is always this: you think about the thing you love the best and the thing you hate the most in practice, and one of those two things should give you a really good research proposal. It has to be something you're passionate about. And that's what I found doing my PhD, was because I was passionate about this subject, it sustained me through the 3.5 years of writing the PhD. And I know you haven't got 3.5 years to do this, but I think if you can find something you're passionate about, you never know where it might take you in the future.